Good morning. Um, so I just wanted to talk briefly about the difference between addiction and physical dependence versus addiction. And these are two things that can be mixed up. Uh, People will see that a person is physically addicted, or sorry, see, I'm already mixing them up myself. Uh, they might look at a person who has physical dependence on a substance and call it addiction. Um, for example, you know, I'm trying to think of a good example. Like say that somebody takes an antidepressant, maybe they take Prozac, and a doctor recommended Prozac will be good for your depression and anxiety. Take it every day, indefinitely. They don't usually have a stopping point. And the patient says, well, how long do I need to take this? Well, it takes 2 weeks to 4 weeks to take effect, and then we'll just go from there. We'll reevaluate, which kind of usually means we're just going to be on it indefinitely, maybe permanently, because we don't really have a plan for an endpoint. We don't have like an exit strategy for that. That the doctors are not really trained in having an exit strategy for these medications. Anyway, so let's just assume that the person takes the Prozac for a year, then 2 years, 5 years, 10 years. 10 years later, they're still taking it, and now they try to stop taking it, and they get physically sick. They get all kinds of terrible symptoms, and they're like, oh, what do I do? And they go to their to a close family member, a loved one. They're like, I don't know what's going on. When I try stopping this Prozac, I get really physically sick. And they're like, oh, you must be addicted to it. You can't stop it. You take it every day. You've been taking it forever, and it must be an addiction. And you might even go to a doctor who might say that, well, you've developed an addiction to this drug. Um, Problem is that that's not addiction. That's physical dependence. No connection to addiction whatsoever. So the question is, what is addiction? Um, but years ago, I spoke to someone who had a crack addiction. Crack being a form of cocaine that's highly addictive, and they smoke it. It works very quickly, and then it wears off quickly. And it's a probably harder addiction to beat than being addicted to regular cocaine. But they're both addicting drugs. But anyway, so I was talking to this guy, and I was just curious. And I asked him, like, how do people overdose on crack? How does a person use too much of this drug? Why would a person keep using it to the point where they harm themselves and overdose? And he looked at me and he said, here's the problem, that no matter how much crack you have in front of you, you're going to be using it until it's all gone. You could have a little bit, maybe you can only afford a little bit, or maybe you've got some extra money and you buy as much as you can afford, and whatever you have laid out on the table in front of you, you'll use it all until it's all gone. There won't be like, I've had enough for today, let me save the rest for tomorrow. You tend to keep going. That's kind of a good example of addiction. That addiction is related to compulsions and cravings. A person craves a drug. They obsess over it. They think about it all the time, and then once they start using it, they have the compulsion to keep going. They can't stop. So when a person, say, goes back to their doctor the next month, and the doctor asks them to bring all their medication in with them, and say they come in mid-month and they go to the doctor and they have their Prozac bottle and they get 30 of them every month, and say 15 days in, they've got 15 more pills in the bottle. Well, that doesn't sound like what the crack guy was talking about. The person on Prozac takes it as directed. They're not thinking like, wow, that Prozac is really good. I just want to keep taking them, and keep popping them one after another till they're all gone. That really never happens. Now with benzodiazepines, things like Xanax, Klonopin, Ativan, Valium. Even though people will say, some people say that it's like alcohol in a pill, they're addicting. I think they get mixed up because they can be intoxicating. They do have abuse potential. A person can take too much of them and take them for the wrong reason, outside of medical treatment. But usually, overwhelmingly, when people get a prescription, they tend to take them as directed. The doctor says, take your Ativan before bedtime. The person usually does that. And usually, if in most cases, if a person goes to the doctor mid-month, they would have all the appropriate amount of pills in the bottle. Benzodiazepines tend not to be addicting, and that seems confusing because alcohol is addicting, and a lot of people like to compare them to alcohol because alcohol and benzos can be intoxicating, but the benzodiazepines tend not to have that addictive component. People usually follow the directions. They don't have the compulsion to take them all. They usually aren't obsessing over them. They follow doctor's orders. A doctor may just keep, just like the Prozac, may month after month for years may prescribe a benzodiazepine, and person finds themselves having difficulty stopping because they get physically sick when they try to. And unfortunately, a lot of the marketing out there, if you search on Google for how to get off of benzodiazepines, a lot of the results that come up are addiction treatment centers, places that claim they can get you off of any addictive substance. And so a person could be misdiagnosed and misdirected. They could be diagnosed, you might go to a detox program and they're like, well, you have a Xanax addiction, and we treat that just like a crack addiction or heroin or fentanyl addiction. It's all addiction to them. And that may lead to improper treatment. They may get the person off too quickly. They may get them into counseling programs more geared for addiction that are inappropriate for that person. So it is very important to know the difference between addiction and physical dependence, which in the case of the benzodiazepines, it tends to be all physical dependence and not addiction. So it's a very important distinction, and it can be complicated. Interestingly, a lot of people are aware of it, even though there's still a lot of confusion over the two things. Interestingly, the Purdue company played a part in promoting the difference between physical dependence and addiction. And they did it maybe for the wrong reasons. It was marketing and trying to get more people in opioids and convincing people that opioids are not as addicting as they turned out to really be for a lot of people. But kind of unwittingly, Purdue maybe helped a bit in promoting, getting the message out there that there's a difference between addiction and dependence, physical dependence versus addiction. But we didn't really need Purdue. That discussion had been going on long before, and the medical community knew about it. It's always been there. We didn't need Purdue to tell us that addiction and physical dependence are two different things, but that was part of their message. But so in saying that Purdue was all bad, maybe they did some good in there. Maybe they promoted the need for the management of chronic pain and identifying it and distinguishing between addiction and physical dependence. But ultimately, they were trying to downplay addiction. And with opioids addiction, it turns out that it was a significant issue. And so they kind of misdirected people in that way. But yeah, anyway, so it's important to, I think it's always important to identify these things properly, to not call every kind of dependence addiction. Even it may seem harmless saying, oh, you're addicted to Prozac, you're addicted to Seroquel, addicted to gabapentin. Those aren't addictions. Those drugs are not addicting. It's physical dependence. And with the benzodiazepines, it's the same thing. It's not addiction in most cases. Maybe there's a tiny percent of people that actually get addicted to those drugs, but it's so rare, and you can usually pretty well identify that a person is using the drug with that compulsion. Going back to that guy I talked to, the crack addict, if you're addicted, you tend to use everything in front of you until it's all gone. And with a physical dependence and no addiction, you tend to follow doctor's orders and take it as directed. So it's not that difficult to distinguish, and there's very few, relatively a small percentage of people that might be addicted to something like a benzodiazepine, such a small amount that in most cases when a doctor